Mentioned in the introduction something that I didn't really have to say about the controversy that has been raised in terms of the Affordable Care Act. I won't even ask you what you think the controversy is all about, but why do you think there's so many problems?
I think there's a lot of confusion about, the fact is in California we're doing well and we're as we should be on the lead of the Affordable Care Act. What's talked a lot about is the federal website, but California is using its own, and there's actually 17 states together that are they created their own health exchanges and those kinds of programs. So we're not tied to the federal hub that we keep hearing about in Congress and in Washington and the national media.
Now, that in itself might be a little confusing for viewers who
Absolutely.
may not know it, but what you're saying is that California has its own website, right, but the website has on it everything that the federal website has on it?
Yes, it has. It's called Covered California, and it's an exchange. That's what it's called. And it provides all of the opportunities to enroll in all of the health care insurance programs that are available through the federal government. But the difference is it's just California's own website. And so our website has not had the issues that the federal website has had, and we've been able to successfully roll out the enrollment process for health care.
So Denise, if you know, how did it happen that California has its own website?
The states had the choice whether or not to roll out their own, what was called a health exchange, and their own program, or whether to use the federal hub. And 27 states elected to use the federal hub. 6 came up with kind of a hybrid between the both, and we came, and other states came up with their own.
Okay, we have a map of the
Correct.
States that are using the federal system and also the states that are not. So if we could see that map right now, it would make sense in terms of what you're saying about how some of the states, and there we are. Mm-hmm. So the yellow states, are those the ones on the federal?
So those are the ones on the federal website, and they're the ones that we're hearing about because that's tied to the federal government. The other states received money to come up with their own health exchanges. So there was money available for each state if they chose to run their own. And those states that are ahead of the game and have been better able to enroll much more quickly.
Okay, now one knows where California is, so the assumption is all of the areas that are red are those that chose their own websites?
Their own, we're going to call them a health exchange, which may include a website, yes.
Okay, now those are, did you say there are 16 states?
There are 17 states totally, including us, that chose to create their own health care exchange. And then there's 6, those are the ones in blue, that kind of created a hybrid. They may be using part of the federal marketplace, and they're using pieces of their own.
So I don't think when you talk about the problems with the website, there is that distinction made. Have you heard that distinction, Lorna?
No, I haven't heard that, and so I think that that's really important, particularly for our 2 counties, Santa Clara and San Mateo County, for the residents to know that they have easy access to a website that is working and to staff that's fully able to enroll them.
So all of the counties in the state of California?
Correct. So the Covered California, you're starting to see commercials now. Well, they didn't roll out until October 1, but we're starting to see some commercials, and it's actually considered a Cadillac healthcare exchange. The exchange itself allows you a lot of good abilities for residents to look at it. For example, one of the things allows you to look at your different plans up against each other so that you can just tell the differences and really spend some time. Because buying a health care plan, if you're purchasing one and you're not eligible for some of the subsidies, is like buying a car. It's not an easy thing, and you have to do some research.
Now, I've heard some people calling in radio shows saying that their policy was dropped, and the policy that they are being provided is more than the one that they originally had.
So I can't speak to that, but as Denise said, that's the beauty of the website, is that they are able to go in and do a comparison. And that's something new, that for the first time they can actually compare apples to apples, all of the provisions of each different insurer, to see what is the best plan for them and what is, in terms of cost, in terms of coverage, to really look at that and what best fits their families.
So an individual can pick whatever insurance option he or she feels best.
Right, and there's lots of choices when you're picking a plan. Depends on who you are. If you're a young person, for example, you're real healthy, you probably want a cheaper plan. You only want catastrophic. You're not planning to go to the doctor very often. You just want to make sure that you're covered and in case of some real emergencies, versus somebody who maybe is ill and has a variety of illnesses. No, they have to go to the doctor more often, so they may want a lesser copay when they do go to the doctor, because that's important to them. You can look at those kinds of things on the website, or you can talk to either county or call Covered California, and you can learn about those kinds of details.
So we have another slide that tells people exactly what they can do and what the steps are. And I think one of them is they can call. There we go. They can go on the website. Can you see that from here? Or you know what the
Yes,
steps are? So what's the first one?
So that one is our one of the flyers that we give to people to give them information about how to enroll. And as Denise said, they can either call our offices, they can enroll online, or they can come in person to our locations, which we have 5 locations that are county-wide, that make it easy for residents to go to the one that's closest to them and most convenient to them, be seen in person, and be able to have a staff person work through the different options with them. And they may not necessarily choose an option right then, because, as Denise said, it does take a little bit of homework and a little bit of time to go through everything and understand what is the best option for themselves and their families.
Okay, now let me ask a question. Lorna, you're from San Mateo, and Denise, you're from Santa Clara. So would the people who live in Santa Clara go through those same steps?
Yes, pretty much. They have the same options. There's no, what we call in healthcare, the whole healthcare reform is there's no wrong door. Whether you call Covered California or whether you come in, there's no wrong place. We're not going to bounce you back and forth. So residents who call Covered California, and after a little while it's clear that they're eligible for some of our Medi-Cal programs or other programs, they'll be what we call warm transferred right to the right county, to their county of residence. So whether that be San Mateo, Santa Clara, or LA, they'll be transferred to the right county, and then it's the county's responsibility to answer them within that call within 30 seconds, at least 80% of the time. And we're doing that 100%.
Now, Denise said that there are 5 offices in San Mateo County, and I'm going to ask you where they're located. How many offices are there in Santa Clara County?
We have a variety of offices in healthcare centers that are accepting, that are working with our clients, the same ones that anybody would go to for our regular social services offices.
Regular social services offices?
Yes. So we have the same model where we have offices in East Palo Alto, Redwood City, Belmont, Daly City, and South San Francisco. And within those offices, people can come in and apply for benefits, including the Medi-Cal and healthcare.
So how do they find out where the offices are?
So they can go on our website, the San Mateo County website, but also that flyer that you had up earlier does give the addresses so that it's easy for them to have it at the ready.
Okay, now the counties, and I did mention, and I'll keep on mentioning, Lorna, you're from San Mateo County, and Denise, you're from Santa Clara County. They work together. Is everything the same in both counties?
Well, many of the rules are the same. Covered California is going to have the same kind of rules, so we're certainly working in concert that way. There may be individual differences, but they wouldn't really matter to the outside, to our customers. I think what's important for our customers to know is actually the 2 counties do a lot together. We work on a variety of programs and processes together. So there's no wrong door wherever you go, and the processes are going to feel very the same, especially around healthcare.
Now, we have heard for some time now, more than a year, about the budget deficits in the state of California. So where did the money come from, or should I even ask? Is this something that's fully funded? You're talking about all of these programs.
These are federal dollars. That's why they're really important too. Healthcare reform, as well as CalFresh, which is our food stamps program, are federal dollars, and both of them are important to us to make sure our residents get those basic services. It's as important to get healthcare as it is to get food so that you stay healthy, and we work a lot in concert, the two counties, to make sure that our residents get those programs so that they stay well.
So why have we heard that people are losing their social services? There is the sequester that has a 10% cut straight across the board. And then the government shutdown that caused people to lose services. So how is it that you can sit here and talk about the money and the programs when on the one hand we hear that social services for, let's say, expectant mothers is something that's lacking?
So I'm not sure about any impacts. As Denise said, I know that this is federal dollars that it's fully funding this program and allowed us to roll out the healthcare programs on time with opportunity for people to have access for information, et cetera. So the issues at the federal level are, as far as I can tell, not currently impacting this particular program.